network and to collaborate and to listen to some amazing speakers that we've got for you today. If you haven't been to one of our events before, I'll tell you a little bit about how this will work. So hopefully you found your way here. You're on the platform, which is great. And just a bit of housekeeping. So each session will have a chat function. And one of the things that's really important to us is that you get to communicate and to share and to network with each other. So please, please, please do say who you are and where you work or whereabouts you are in the chat. Introduce yourself, get to know each other, chat with the other people and share any thoughts, ideas, insights or links. It's really important that we make the most of this time together and have the opportunity to network. And if you can do that for each session as well, because it's a mix and match of the day, so people might come to sessions later on in the day that weren't at the first one. So please, excuse me, please do introduce yourself again. Quick pause for breath there. We also have Q&A on the platform. So next to the chat function on the right-hand side, you can ask questions, put your question in, and go in there to have a look at the questions and upvote the ones you would like to be asked at the end. If we can't get through them all in this session, we will provide some answers, we'll put them in the chat, but also we'll do a Q&A, which we'll attach to the bottom of this particular session. So the other thing is we have a couple of polls that are going to be running in this session, and have a look out for those in other sessions. There may be ones in other sessions as well. And click on that link to see the poll questions and answer them. We also ask for feedback for each session. It's really important that you let us know how it was as an experience for you, and so that we can improve on it and make sure that you get the best experience for the time that you're investing with us today. The other things on the site, if you scroll down on this particular session, you'll see that underneath the description of the session, you'll find information, some links, and below that you'll see the speakers. There's myself, there's Henry Wilson, who is helping to launch today's session, and below that you will find that there is a document section. So we've added some documents for this particular session, so go in there, have a click on any of those. It also includes the agenda for the day. So have a look at those, and then on the left-hand side in the menu bar, you will find that there is an ability to network, to connect to others and to message. There's also the Twitter feed, so do tweet about it and let everybody know if you're enjoying the sessions. And if you have any problems, if you scroll down to the bottom, you'll see that there is a help desk. If you message the help desk, they will help to resolve your issues. So welcome if you're new, and if you're a regular at these events, it's fantastic to have you back. So that's the housekeeping. Moving on and getting into the update, which we're going to do first. So I'm going to provide a bit of an update on what's happening in the profession. You know, how things are developing. We have a very exciting launch happening today, so I'm really, really excited that you're all with us to share that experience. Henry's going to talk a little bit about the sessions for today and the aims of the day, and then without further ado, we will get on and get moving. So in the news at the moment, things that are happening within the profession. The Infrastructure and Projects Authority, which sets the standards and oversight of major projects in the public sector. One of the things within their mandate is around building workforce capacity and capability, and they have been progressing with the development of skills levels accreditation. So people are starting to be accredited and assessed at specific levels so that that can support them with their career development and opportunities for being matched with the equivalent level or stretching level of project assignments. So that's really exciting, and we will do more about that as that sort of starts to shape in the healthcare sector as well. We've also very happy to be informed that there's been an appointment of the Chief Project Delivery Officer for Department of Health and Social Care. This is a role that's been rolled out across each government department, and the CPDO for healthcare is Andy Britton. He's also the Chief Financial Officer for DHSC. So there's a real opportunity for us to collaborate with finance and to look at how we can work together to support delivery of, major projects, and also to get his input into developing the profession. So that's really exciting news, and we will hopefully get Andy to come along and meet you all at the next event, which we're doing jointly with HFMA, hopefully. So that's the plan. Andy will represent the healthcare sector project community at the Projects Council that's run by HFMA. By the Infrastructure and Projects Authority. So part of our role will be to provide information and updates for him to take to that council for decision making. So on that thread, we have the heads of profession steering group that's run by DHSC, the ALBs, and representatives for the wider community have been developing a strategy for the profession in healthcare. And working on testing out the IPA accreditation process. So again, we'll provide more information about that in probably the next newsletter update. We also have the merger that's going on that's kind of getting in place in terms of merging NHS England, NHS Digital, Health Education England, NHSX, and obviously previously NHS Improvement. So that's all going forward and taking place and will become in legislation in the 1st of April. So I'm working with my counterparts in the other organisations to look to see how we can shape the policy and strategy for the profession in the new NHS England that will help to position the profession well going forward. And alongside that, there's a real shift in interest in workforce data. So looking at supporting the sector with workforce capacity and capability. So we're also looking at that at the moment to see how we can identify the workforce and support workforce development. And linked to that, then we have the development of the association, so the Healthcare Project and Change Association, to deliver on all of the great things that associations do. So professional development, events, networks, education and training, all of the things that will enrich careers and enable the system to have the right skills and competence. So moving on and talking a little bit more about the development of the profession. For those of you have been around with us for a while, you may be familiar with the progress we've been making. You may have been at the first event that we had in 2017 and the launch of our initial community of practice. Since then, we've managed to progress quite a lot despite all of the changes that are going on and despite the COVID impact. So a lot happened since then. We had another conference 2019 where we looked to progress the profession and develop the regional networks. All of this will be available, so if anybody's interested in the detail, we'll put the slides on afterwards so you can see what's happening in detail in relation to the programme and progress against the plan. But taking it forward in terms of the next steps, you'll notice that phases 3 and phases 4 overlap. So one continues on while the other starts because a lot of this stuff takes quite a while to embed, but lots of exciting developments in there. And we're really starting to make an inroad in terms of making this happen. So skip one. In terms of priorities for 22-23, we have a number of key deliverables. So if you're interested in getting involved in any of these, we have working groups and we have representatives, but always happy to have new ideas, fresh insights, different perspectives, helping us to shape and develop all of these for the community as a whole. So in terms of the transition, and I appreciate this as a gallop through because there's so much information to share and we don't have a huge amount of time to share it with you because we have such an amazing agenda for you today. But in terms of transition, when we started out with a community of practice, and it was very much the NHS in England centric. and that's grown and built originally from 10 organizations. It's now across the landscape. We've got the regional networks. And there is something about the changing environment that we're working in that we need to respond to make it fit for the future. So some of the developments that are going on around the profession are, one, we need to connect up across the healthcare sector. So we've got organizations that are civil service, and with the advent of the development of the integrated care systems in England, it means connecting with social care organizations, local councils, charities, and others that contribute to the delivery of services. And of course, this isn't just in England. We have a great community of practice in Scotland. We're developing them in Northern Ireland and Wales. And for us, there's a really important thing that this is, we are project and change professionals. Working in healthcare, we face the same challenges, we face the same issues, we have a lot to share and offer each other. And it's really important that that community is open to all. So part of our evolution is moving beyond that voluntary collaborative, the first few organizations that came together to create NHS Project Futures, to where we are now, which is that ability to really transform and move to the next level of development. And for us, this is about the shift in terms of where it sits within the new NHS England. So NHS Project Futures will form that function within NHS England. It will represent the policy and strategy and workforce development for the workforce in England and for the community as a whole, and to provide services and opportunities to network, events, etc. We have set up the Healthcare Project and Change Association. And that's about being inclusive, and that's about including social care, civil service, all the countries, making sure that we include as many as we can to make this as representative as we can, so everybody gets to benefit from all of the engagement, the products and the developments and the services that we have. So this is the moment that it's happening. And so this is about really developing to the next level. And everybody who's been with us on the journey so far, thank you, because whilst I have the most amazing team who have worked incredibly hard in addition to their day job to make all of this happen, it's not just a few of us, we happy few, it's the many, it's us as a collaborative community. And not just in healthcare, we have community members from across government, we have them from different professions. And it's really important that we collectively are the ones that make all of this happen. So thank you for joining us on this journey, and I hope you will continue to join us and collaborate and be a part of the next generation of the project and change profession. And so, without further ado, with a dramatic drum roll, if we had one, I would like to introduce you to the Healthcare Project and Change Association. So it's been many years in the making. The idea for supporting the profession started nearly 10 years ago now, when I came into the NHS and found there was nothing in place. We launched the first community 5 years ago, and in all that time, look at all of the amazing things we've collectively developed and got to this point. I am so proud of everything that this community has done to develop the profession and to make it appear amongst its peers. So the Healthcare Project and Change Association is hosted by the Healthcare Financial Management Association. It's a charity. It provides all of this to the sector, not for profit, to make sure that the sector has a sustainable voice within the sector that represents the needs of the members. And that's a really critical thing, because it's outside of the political sway of the individual ALBs or central organisations. It represents the members. And this is going to be really important going forward, because this is about us as a profession and what we can do to support the sector to develop. Membership is open to individuals in healthcare and public sector. We want to make it as inclusive as possible. It's supported and funded through corporate membership, so we can provide information about that. There's a guide at the bottom that tells you more about the association. Thank you so much to the team that has not just brought us to this place and worked incredibly hard on building this and getting it ready, but also for the team at SEA who developed the logo and all of the things that help us set our brand for the future and represent who we are. So about the HPCA, as I mentioned, there's a guide down below, which is a corporate members guide that has information about it. It sets the standard, and it's about us and who we collectively are and who we represent. There's more about that in the guide if you want to have a look at that and read more about it in detail. We're also launching the website today. There's a link below in the screen in the description session. And all credits to Blanca, who has done a phenomenal job in creating this website and pulling all of this together. Now, this is just the start, and this is just the place we are setting off from. So not everything's in place yet. We will be building and growing it and evolving it as we go. So this is us starting out on this journey. And the thing we need to do is we need to go together. So because we are transitioning from the NHS Project Futures community to the association, the one thing we need to do, because it's in a separate organisation and being managed through there, is we need people to register. So we can't transfer the information. So if you can take a minute, use your phone, click on the screen. There's also a link below in the description that you can click on if you want to do it on your laptop or desktop, and register to subscribe to the association today. It's effectively providing everything NHS Project Futures did, but more and wider and more inclusively. And it's open to everybody in healthcare in the public sector to join up. So please do. And be the first members, be there at the start, and come with us on the journey. So I'm mindful of the time, and we don't have a huge amount of time left. So if you can do that, and I'm going to hand over to Henry Wilson, who's going to tell you a little bit more about the day and the amazing things that we have for you. So over to you, Henry, and thank you, everybody.
Thanks very much, Jo. A very, very warm welcome to everybody. I hope you have a brilliant day. I'm Henry Wilson. I'm the Head of Transformation at University College London Hospitals and also the London Region Network Lead for NHS Project Futures. I'm incredibly excited about the day ahead. It's another brilliant event brought to you by the NHS Project Futures team, the wonderful team there, and the Healthcare Project and Change Association, which Jo has just officially launched. The day has got loads of fantastic sessions. We'll be hearing about what makes a difference in digital project management in healthcare. The IPA will provide their perspective on digital. Paul Gillart's going to be talking about frontline digitization. We'll be looking at the power of storytelling to aid project delivery, and also how you set up your projects to deliver successfully. So hopefully you'll be able to make as many of those sessions as possible. And it's really important. The digital agenda affects all of us working in health and care across the NHS, on the front line, those supporting delivery to our patients and populations. And you kind of can't escape it, even if sometimes you really, really wanted to. It can be a source of frustration and risk, but also a great source of opportunity and innovation. And in my own world, in the NHS, the importance of digital transformation is central to the long-term plan. You can see there, it underpins the importance of technology in the future NHS. We need to harness it, we need to embrace it, we need to evolve it. And I'm sure for many of you joining today, digital will have a considerable impact on your working lives. And so for our first poll, we would like to find out, we think it'd be really interesting to know the extent to which digital or technology is, what percentage of your sort of working day involves a digital or technology component. So on the right-hand side of the screen, you'll see a button that says poll. If you go in there and you could give us your answers, it'd be fascinating to know. I personally probably spend at least 40 to 50% of my time involved in projects and programs that have a digital component, and see every day how that can be a great enabler to improving our services, helping make things more efficient and achieve high quality in service delivery and sustainability for all of the services we provide in our trust. So go into the poll, give us your answers, and hopefully in a second they will appear, and it'd be fascinating to see what percentage of time people are spending on digital. Presumably, because you've joined today, it's probably quite a lot if you are, interested and impacted by this agenda. So I'm just going to wait for the magic of the platform to tell me the answers. While we're waiting for that to come up, I'll just carry on. So digital is not just about software, hardware, programming. It's about change. It's about behaviors. It's about a mindset, and often shifting that mindset. And I think this is where the Healthcare Project and Change Association can really, really come in. And as we can see there from the results that are now coming through, that this is pretty much filling up most of our agendas. Almost half of you are spending more than 3/4 of your working life involved in something associated with digital. And I'd just like to reflect on some of the ways in which the Healthcare Project and Change Association can support us. So like I said, it's about change, it's about mindset. If we move on to the next slide, please. Okay, so I found a couple of really, really interesting quotes. And the first one talking about, it's not that the thing that's transforming is not technology, it's technology that is transforming us. And the biggest part about digital transformation and digital projects and programs is changing the way that we think. And with the support from the Healthcare Project and Association, it will bring a holistic approach to supporting you, your colleagues, and your organisations. And crucially, it's inclusive. It spans digital, projects, change, strategy, transformation, and improvement. It helps us professionalise the way that we work. It helps you connect with others. Indeed, to be successful, in future, we need to work collaboratively across organisational and professional boundaries to achieve our outcomes and develop better solutions for the challenges that we all face. We need to do this in multidisciplinary teams. And so the association is here to help you do that. And we'd love to know more about what we can do. So I'd like to move us on to our second poll before we get underway with the day. And that is, we'd like to know, how can the association better support the professional development of colleagues working across digital projects and change? Like Joe says, there's an awful lot on offer. And the more input that we get from yourselves, the more engagement that we get from yourselves, the more that you support the association and be involved, the more that we can build, which creates a virtuous circle, which comes back to you and your teams and helps them to do their jobs better, to do their jobs more easily, to do their jobs, deliver projects and programs quicker and more effectively. So the poll sort of asks, it gives you some ideas around, some of the things that we could focus on in future. If what you think is really important isn't there on the screen, please also put any comments or questions into the Q&A. We'll have a few minutes to reflect on those in a second, and then we can also take them away and get back to you. So go into the poll and let us know and help us prioritize the things that we can develop over the coming weeks and months. So the results are beginning to show. You can see there that currently people think that all of these things are important. Professional accreditation, of course, part of the one of the major aims of the association is to increase the professionalisation of the service in health and care, of project and change delivery. People want, to ensure that we've got strong networks. And I think the association, these events, NHS Project Futures is already a brilliant way to help us connect with peers. After all, a lot of us are working on very, very similar problems and challenges. And the more we can do to avoid reinventing the wheel, the more that we can do to share solutions to those problems, the easier our lives will be. So, as Joe said, we've been on this journey. Your ongoing support is absolutely vital. So if you are already beginning to see the benefits that myself and colleagues at UCLH see, please get in touch. Find out more about how you can get involved and help us with the next stage of developing the association. So that's everything from me. On with the day. I'm going to hand back to Joe, who will now spend a few minutes reflecting on any of the questions that have come in and introduce the first session, which will be starting at 9:45. Joe, back to you.
Thank you, Henry. That's fantastic. So the question is, do we have any questions?
I've just got a couple coming through at the minute. The first one is, how widely is this known through the NHS?
In terms of the development of the association, is that what we're assuming?
I'm assuming, yes.
Okay. So one of the things that we've been trying to do is to really raise awareness. Now, up until the development of the association, until some of us have been seconded to it, it's been an add-on to the day job. So one of the challenges for us has been to find the time to not just develop the profession, but also do all of that networking and collaboration and communication that it really needs. And one of the things that we really could do with you helping us with is to suggest who should know about this, how should we communicate with them? Because we only know what we know, and it's such a vast and complex sector that actually it would be impossible to know everybody. But if you think about the 6 degrees of separation, you can probably connect us up with organizations, individuals, networks, leads, all of the key people that you think should know about this. So start to put some comments in the chat, but also what we'll do is we will create a form with some suggestions and say, tell us how we can communicate this, who should we network with, and how should we promote this so that it is known widely and engaged with widely so we can get the best value from it. You can help us to make that happen.
Excellent, thanks, Joe. A question has come in terms of where our focus should be. So I believe they're thinking along the lines of, should we be talking more on business transformation, which is enabled by digital, rather than digital services or digital transformation?
I think that that's a subject for us all to communicate on and to discuss. I don't think we should be setting direction. I think we should be collaborating on what does the sector need, what do our customers need, whichever sector we work in. And are we designing the things that they need and in a way that is most useful and effective for them as well as for us? So I think keeping the service, the user at the heart of what we're developing is really important. And then we work with what's the best way of delivering that. But again, we come from different perspectives and different lenses. And I think coming back to Henry's point about the multidisciplinary team, actually, it requires all of us to come together to look at it through different lenses and to work with those service users to find out what's really needed, and then to collectively develop the services that will actually deliver the outcomes we want to achieve. So I think it's a mindset and less of a process from my perspective. Okay, so any other questions in the chat?
Super. I know we're short on time, but very quickly, how can we promote and support the association?
Thank you. What an awesome question. So word of mouth with your communities. We've put the corporate membership guide in the documents list below. So if you just open that and save a copy, one of the things we will be doing, we will be writing out to all of our current community members, letting people know what's happening, giving them the option to sign up to the HPCA to transfer so that we can keep the community going, but also with some comms so that they can share it with their colleagues and also through their internal organizational communications as well. So that email should be coming out hopefully to you tomorrow so that you can share that information with others. And if there's more we can do to connect and share it out, put your thoughts and ideas in the chat, because for us, you're the ones that are the ears on the ground and you know how best to connect with the community that's out there. And that's all the workforce. This isn't just for the rarefied project and change people. A lot of what we do is around upskilling everybody, and we need the whole sector to have the skills needed to be able to engage with change. So let us know what we can do, and we will send some information out to start the process going. But also it will be an ongoing one, and we will keep in touch. And do keep in touch with us as well. Be part of the community. Join your regional network. Give ideas to Henry in the London region and his counterparts, and Abu in Scotland, also the specific interest groups, and also the champions and ambassadors. So if you aren't a project and change professional in the healthcare sector, that doesn't mean that you can't help us, you can't contribute. You can, because you can join the champions and ambassadors and help to engage other thoughts and ideas and spread the word into other professions and communities. So on that note, and then I'm running over now, but that's not bad for our first session. So thank you everybody for participating and joining in. And just in terms of moving on to the next session, we are really, really privileged to have Martin Dennis, who is Associate Director at NHS Digital, and he's going to come and talk to us about the difference about digital project management in healthcare. So you have a quick opportunity to get some refreshments and to come back and spend some time learning from and connecting and sharing thoughts and ideas on that subject. So thank you. Have a wonderful day. You get out of this as much as you can contribute. So please do get involved. Put your thoughts in the chat. Make sure you connect with others that are there. And we will see you throughout the day. Thank you so much.